Good afternoon. It's my pleasure to present a webinar on interventions to prevent occupational low back pain. And I would like to start by introducing the team and myself. My name is Sebastian Straube, and I'm the senior author of the paper about which we're going to talk and the research project on which this is based. I'm privileged to be joined by Dr. Daniel Sova and Mr. Robert Boyko, as well as David Antle and Dr. Michael Zakari, who will be one of the presenters this afternoon. And you are asked to write your questions and ask us about anything that you would like to know further information about. Following the three presentations, first by Dr. Sova, then secondly by Dr. Zakari, and then thirdly by Dr. Antle, we will respond to the questions which you can send us. And you are asked to write your questions and ask us about anything that you would like to know further information about. Following the three presentations, first by Dr. Sova, then secondly by Dr. Zakari, and then thirdly by Dr. Antle, we will respond to the questions which you can send us.
Thank you, Michael and Daniel. To this point, they've covered some clear guidelines as to how to be effective in using exercise in a workplace. But of course, exercise interventions, for anybody who's worked as a rehabilitation medicine specialist, a safety professional, or a consultant in these environments, understands that it's quite logistically challenging to actually implement these programs in an actual workplace that has a lot of dynamic things happening. Of course, people are interested in maintaining their productivity, social factors associated with the work, and of course, introducing any kind of exercise programs, we have to ensure that the culture that exists at the workplace is appropriate, and how do we build that culture? And secondly, what approaches can we actually use to ensure we're engaging the frontline workers in the most appropriate way? Some important considerations around this, if we sort of reflect on a lot of the work that's been done in ergonomics and occupational health and safety, suggests that workplace exercise programs do show to be quite beneficial, of course, based on the review that my colleagues have already outlined. But the acceptance level in a real-world setting is sometimes a little bit hard to nail down. Sometimes workers are very open to doing this, and other times it can be quite problematic. So the first thing we really want to do is understand at what level of change, the change stages that a workplace might be at, to see how this might be implemented going forward. And of course, fortunately for us, there are a number of tools out there that do assess readiness for change and current safety cultures that exist in a workplace. Some key things we might want to focus on with that are, first of all, making sure that before you engage in any kind of an exercise program that you're trying to implement, that the workers actually have effective education and understanding what the hazards are and what hazards exist at their workplace that might cause low back pain. And with that, if they understand why they would want to avoid the hazards and how exercise might be involved with it, having that why piece, they're much more likely to accept anything we want to do to implement exercise and education strategies. And as Michael clearly outlined very much in the last few slides, is that education and exercise together are effective. And if we're able to deliver the right message in the right way, it's more likely that the education process will actually lead to better acceptance of the exercise program. And another key component that's often overlooked with these programs is the workers are actually the ones that really have to take ownership of it and to be engaged in it for it to be effective. And if we're going to provide training and education, the first thing we want to remember is to really glean what we've learned from participatory action research models and in the ergonomics and health and safety field, it's often termed participatory ergonomics, and actually ensure that you're engaging the people, having them champion the cause, and actually even perhaps use a train-the-trainer approach so that they themselves are actually engaged in delivering all the content. The other important piece, and it kind of goes back to why would you want to do this program and why would a worker really want to engage themselves in this, is the exercises that you choose to be included in the program might want to be rooted and linked to the physical demands associated with the work. In Alberta, it's common that a lot of workplaces actually have a categorization of the physical demands levels for each of the jobs and each of the tasks. And if you could show how the exercises actually link to those tasks, it's more likely that they see the benefits of the program and are more likely to engage. And finally, the sustainability of the program, again, is heavily rooted in how much the workers themselves feel ownership of the project. So allowing for continuous improvement models, allowing for feedback, allowing for changes that reflect changes in the workforce, and the interactions among the employees is also a key component. With that, I'd like to bring this component of the webinar to a close. On behalf of all of our colleagues here, we'd like to thank the Alberta OHS Futures Program for their generous support through a research funding grant. The link to the paper that has been published is provided here. At this point, I'd like to turn it back over to Dr. Strobbe, who will take some questions. Thank you.
Thank you very much. At this point of the webinar, the audience is invited to submit questions. And depending on your preference, you can submit those in writing as a comment, or you can ask us, and if you have a microphone capacity at your workstation. Is there anyone who would like to ask a question? And I'm also going to use the chat to ask for questions. I see that we have a participant typing a question at this time. And it's Dr. Els, I believe, from Edmonton, who is asking, I may have missed the piece, but I wondered if there is any psychological elements identified that may modify pain. And that's, of course, a very topical question, because pain as a subjective experience is heavily modified by psychological and psychosocial elements, and there are a lot of factors at the workplace that play a role. Other evidence that we have not directly used for our overview speaks to the experience of pain, which may actually be related to factors such as workplace bullying, as well as the demands and the level of control that workers have at the workplace. The educational interventions, which are, well, can be part of a successful combination of educational and exercise interventions, would also address some of these factors. Any other comments from any of the authors as to psychological factors or interventions? Hasn't come up in itself as a sole factor that is able to lead to a demonstrable benefit, but is certainly very important, and it may reflect in part what was studied in the studies that were included in the systematic reviews that were then included in our overview. So thank you, Dr. Els. I think it's a very important topic area to explore. Are there any other questions from the audience? If not, I would very much like to thank the sponsor of this research project, the Alberta Ministry of Labour, who supported us through their OHS Futures Research Funding Program, as Dr. Entel had outlined. And I would also like to thank my co-presenters as well as the authors of this publication, which you see referenced on that last slide, Dr. Sova, Mr. Boyko, Dr. Entel, Dr. Miller, who couldn't join us in person today, and Dr. Sakari. With that, I thank you very much for your participation in this webinar and wish you a good day.